Namaste everyone. So this is Dr. Meenakshi. As you all know, I am working as an assistant professor in Department of Kamarabritya in Ashwini Ayurvedic Medical College, Tumkur. So today we are starting a stream of health issues, not only health issues, even our normal lifestyle and in disease part also. In coming sessions, we will discuss about particular diseases also. So today is the first session and I'm explaining, as its first session, I'm explaining what is this health and how we can maintain in a normal way. Because if we want to know what is the disease and what are the complaints, initially we want to know what is the basic topic of health. What is this health? How we can maintain it? Then if we are not able to maintain it in a normal way, then we will be moving in a diseased part, right? So in today's session, we will get to know what is this health and basic points of health, how we can maintain it. So basically, as I said, what is the definition or what is this health? According to our WHO, this health is a state of complete physical, mental, and social or emotional well-being. As we will get it in sentence only, right? Not only diseased part. WHO says if you are without any disease, you are not a perfect healthy person. You should be perfect in physical, mental, and social or social well-being or emotional well-being. These all in a normal state, it's known as a health. In the same way, same sentence, what our Ayurveda say? That is, our acharyas explained in a term of shlokas, that is, samadosha, samadhatu, samagnischa malakriyaha, prasanatmendriya manaha, swastha itya abhidhiyate. Means, same way, samadosha and samadhatu, nothing but physical well-being, and sama agni. Even they considered sama agnisha, means digestive power in an equilibrium state or normal state, and malakriya, excreta, whatever urine, feces or sweat we are excreting, that should be also in a normal equilibrium way. And prasannatmendriya manaha, means all emotional or social well-being with the society or your stress management, everything should be in a equilibrium way. Then only a person is known as a healthy person, according to our Ayurveda. And same, the model also explained, WHO explained same thing. And by knowing this definition, some components will be that components depending on the health. These components, some 7 components we have. These components are totally dependent on health. If these 7 components are in equilibrium state or normal state, obviously we will be healthy. Which all are those? We will see. First one is, as we all know, physical one. Then mentally capable one, or socially means the behaving with the environment, maybe neighbors, maybe colleagues, or stress management socially. If we are mentally stable means there will come stress, but socially means our behavior with the surrounding will come under social. Financial, why financial? Because obviously if we are stable with the financial, we will be happy and all, maybe in a diet, food, or maybe the external things what we need will be in a sufficient way, right? But if we are weak in a financial, obviously we will be in stress or mental stress will increase. It will hamper again our health. And next one is spiritual. Spiritual means nothing but indirectly it may come under the mental capacity only. Then environmental means we can depend on seasonal, or we can depend on our daily routine activities, or maybe our daily working capability, these all. And occasionally means like maybe dependent on environment, or maybe some mislead to the activities may cause ill health. So these all 7 components, which are those physical, mental, social, environmental, or financial, spiritual, and occasional, these all are interlinked between one another. Those are interdependent on one another. If one hampers, rest all 6 will be hampered. So that due to this hampering, it will make issue in our health. So to be a healthy person, we should keep in mind these 7 components. Now these are 7 components depending our healthy person. But what are the factors affecting our health? Though we came to know these 7 components depends on our health, but what are the points to be which affects the health, factors affecting health? Those are divided into 5 forms. That is, one is genetic one. In this genetic one, we are not the reason for that, right? It depends on our ancestors, genetic, which will carry hereditary. Some diseases are hereditary, even disorders, diseases, some diseases are hereditary. We can't avoid them, but we can prevent them. For example, diabetes. Obviously, if our parents are diabetic, as we all know, it is a hereditary, so it will come to us. But one thing is, if we didn't follow a healthy way, then we can become prone to diabetic in a sooner age, like nowadays 30-40 only. But if we maintain our healthy way in a healthy lifestyle, that obviously, as it is hereditary, we will be suffering, but we can prevent it for longer duration. Instead of 30 or 40 years, we can move it to 50 or 60 years. At that age, we can become prone to a diabetic. So one thing is genetic one, factors affecting our health. Next one is behavior. Some behavioral disorders particularly we have, like maybe breath holding spell, or some behavioral disorders which we see especially in children. These all we can see. These are particular diseases according to the categories, we'll see in further sessions. But behavioral one is one of the factor which affects the health. Then next one is environmental. We can consider as seasonal one, or the factors affecting, like maybe for a best example, environmental is polluting. Pollution is a main cause for the respiratory disorders. We all know it, right? Respiratory allergies. So environmental one is a factor, or physical influence. Though we will be knowing this, we should not have in a particular condition or particular situation, then too we will have. That is nothing but physical influence. Like maybe, for example, we all know that in rainy season we should not have a cold things in a more content, so that it will affect our health. Then too we will have. Obviously, physical influence, it will or it may be like a new type of virus. For example, coronavirus, it is a one type of communicable physical influence. 1-to-1 it got prone, and we got exposed, and we suffered. That is physical influence. And another thing is, last, fifth point is medical care or social factors. Medical care, nothing but any other external factors which may be the exposed to other environmental, or maybe the external injuries. These are external factors we can have a health issue. That is 5 things which affects the affecting factors of the health. Those are genetic, behavioral, environmental, physical influence, and medical care or social factors. These will affect our health in one or other way. But the preventive aspects and how we can protect from these points, we have to know, and we should get their knowledge, and we have to prevent our diseases. And now moving towards the maintenance of health, how we can maintain our health. Think. Obviously, we came to know definition of health. What is this health? And next thing is, we came to know 7 components of health which are dependent on our health issues, so that we can cover 7 points, 7 components of health which we can prevent, and we can prevent the disease, or we can protect the health. Then we came to know factors affecting the health, 5 points which are affecting our health, how we can prevent it, and what are the causes of the health. Now moving towards the maintenance of health, how we can maintain. Especially our Ayurveda explains as the main aim of our Ayurveda is only swastasya swasthya rakshanam aturasya vikara prashamanam. Means to maintain a swastha person in a healthy way, healthy person who are healthy, who have means, especially our Ayurveda, see the motto or the way of explaining our acharyas. they are not treating only the diseased person. What they say is, our Vaidyas or doctors' work is not only treating a healthy person, but keeping a healthy person, sorry, not only treating a diseased person, but treating a healthy person in a healthy way to maintain their health in a healthy way, and treating a diseased person in their particular complaints. If the person is having some diseases, we will treat a disease with their complaints. If the person is healthy, we will help them to continue their healthy pattern in a healthy way, health in a healthy way. For example, what we can do, like how we can prevent this or how we can treat this line of treatment. Obviously, in a diseased person, we will go according to the complaints and we will treat them. But in a healthy person, we will explain them the healthy lifestyle, how we should maintain the health in a healthy way. Healthy lifestyle means dinacharya, nothing but daily routine, how it should be, what all they should do to maintain their health. These all we will see. And Ritucharya is nothing but seasonal routine, like in particular season, what all points we should keep in mind to maintain our health. Example, in summer, what all tips you should use in your daily routine to maintain your health in a healthy way, not to prone for diseases, because as we all know, there are some diseases which are prone or which are exposed to seasonal. In summer, we have particular type of dehydration diseases or some type of allergies, and in winter we will be seeing respiratory allergies, and in rainy we will be seeing cholera or something diseases which are related to water polluted. These all we know, right? We have different types of diseases according to our season. So in Ritucharya, we will explain what all points you should maintain in your daily routine, what all you should follow tips in your daily routine, so that we will not be prone for these seasonal diseases. And yogas and asanas, nothing but to be active in your daily routine. Obviously, we know how much calorie we are intaking. If that much calorie we burn, obviously we will not become obese or bad cholesterol will not increase. These all we know, right? So what all particular yogas or asanas or exercises to maintain our health body in a healthy fat, not only if you are increasing fat, also how we should increase the fat in a healthy way. Healthy fat, how we should increase, we will explain. And some home remedies, as we know, especially in Ayurveda, we have some sort of home remedies which will be available in our daily routine kitchen only. In kitchen, how, what all things we can use and we can maintain our health. Best example is normal basic thing, daily after getting having one glass of warm water. This is one of the home remedy only, right? But it is a not treating a disease, but it is a maintaining a healthy persons in a healthy way. These all dinacharya, ritucharya, no, I am not explaining in this session. We will be having next sessions on the same topic. One day daily routine, what all you should follow. One day seasonal routine, in which season how you should tips you should follow. That we will see in a coming sessions. Day by day we will go through it. And today the last point is, now we came to know definition, factors affecting, components which are dependent on health, and how we can natural, a basic point, how we can maintain our health. But basic point how we can maintain our health, just definition or points I mentioned. In coming sessions we will go in a deeper way. But last, some tips, overall tips to maintain our health. How you can, overall basic tips, how you can maintain your health. I didn't added home remedies here, because particular home remedies will be for example, if I say some drug to have a what example we can take is maybe haridra. In Ayurveda we say, if we have a haridra, then it will cure the turmeric. Nothing but haritra is nothing but turmeric. If we have small pinch of turmeric in our daily routine, then it will act as an Ayurvedic antibiotic, but it will not be dependent on all Prakriti people. So I'm not going to tell a particular home remedies, because we will have a session of home remedies also. In that session, I'll explain which Prakriti people what home remedies can take. Because now overall, if I say home remedy, for example, we will be having different type of Prakriti people according to our Ayurveda, according to our Acharyas. That is, basically we have three doshas: Vata, Pitta, Kapha, and from these doshas, the person's Prakriti will be dependent. Some may be only single Vata, Pitta, Kapha, or some may be bilateral, like Vata, Pitta Prakriti people, Pitta, Kapha Prakriti people. But these home remedies will not give result on all Prakritis. So we will have separate session for that. Some basic point I'm going to explain, overall tips to maintain health. That is a healthy diet. Basic is eat a healthy diet. Healthy diet is nothing but, we all know it, right? We should have a homemade food. We should not have junk foods in a daily routine. We should not encourage people or expose to the snacks like junk foods which increase our bad cholesterol. We all know it, then too we will have it, right? So we should maintain this. I'm not saying totally avoid having junk foods, but limit your junk foods. Rather than having or depending on whole junk foods only, limit your junk foods. Have more homemade food, have less quantity of junk foods or any other snacks, and be physically active. Because if you didn't burn calories which you take, that will be converted to bad cholesterol, and it will increase your obesity, and you will be prone for one or other diseases. So what we should do, we should be active. Not active means not totally active, but some other physical activities should be present. Physical activities means, nowadays people what they think is, we are going to office, we are sitting there, we are coming back, this is an activity. It is not an activity. You are going, you are sitting in a car or a vehicle, you are going and you are sitting in a seat or chair there, you are doing your work and you are coming back. That is not a physical activity. Physical activity means some or other exercises which burns your calories. That should be. And women can say, we will be doing all works in home works like washing clothes, that all. That is also not a physical activity. Just one or other movements you are doing, but you are not burning calories there. Physical activity means maybe the yoga or walking or exercises which burns your calories, and in a healthy way, not in a intolerant capacity. Also in a healthy way, you should be active, physically active, and get vaccinated. Get vaccinated means not only like you should go and take injections regularly, not in a medical like medicine way. Normal get vaccinated means like some home remedies you can follow to maintain your health. And obviously in some situations like corona and all, if needed, we should be vaccinated in a medical field way. And don't use more tobacco. Not only smoking, in other things like junk foods also, or in other varieties of diet or activities also, we are using one or other indirectly tobaccos, right? You can see the content of some ingredients, or less the use of tobacco. Especially the smokers, avoid the smoking, and avoid or minimize the use of alcohol. Even alcohol means not only the alcohol things, even some beverages or in daily our routine, we can see the content of alcohol present in our routine lifestyle, right? Especially these junk foods only. So avoid them, avoid taking of alcohol. And especially who will take more amount of caffeine, limit your caffeine intake. And manage stress, especially because the stress is the main cause for the all ill health. Especially it will, if you are being in a stressed situation, obviously it will hamper your Agni, and our Agni is the main root cause for our health. When your stress hampers the Agni, your Agni hampers the doshas, and from there, whichever dosha will be vitiated, you will suffer according to the vitiated dosha disease, you will suffer. So manage your stress, have a peaceful rest in a comfortable way, and practice good hygiene. This is the main thing. In Corona, we came to know about this very well, right? Maintaining hygiene is a very important thing. Don't speed up or drink and drive. This is a common factors affecting the health. We saw some environmental factors also were there, that it will come. And regularly check up your health, and drink moderate water, not plenty water. All will say drink plenty water, plenty, not plenty, moderate. How much you want for your body, that much you drink. You can go for the list of water intake according to your BMI, or according to your weight, or according to your age. It is different. Not plenty of water means always you should drink water. Drink moderate water, how much your body needs, and don't skip the meals. If you skip the meal, it will hamper Agni again, and it will hamper the doshas. And get enough good sleep. This is the another thing to have maintain your mental stress. So these all are the basic tips. I'm not giving here a strong tips or according to your health anything. As I said before, that home remedies particularly to maintain your health according to your prakriti will have a separate session. These are the basic tips to maintain your health in a healthy way. And in coming sessions, we'll go towards the dinacharya, ritucharya, everything. And my tomorrow's session at the same time, 5 o'clock, will be the dinacharya, that is your daily routine, how it should be, and how you can maintain your health in a healthy way by your daily routine tips. So this was the just small basic knowledge about the health. Hopefully you got the topic, and my explanation is clear for you. If you have any questions, you can comment in a comment section box. Thank you.